Hi there, this is Dr. William M. Chansa, and in this video I'll be taking you through laboratory values and investigations. So I made this particular video for those that struggle to make it in medical school. So if you find it difficult to make it in medical school, this particular video is definitely for you. So first things first, I made this video out of passion. I noticed that most of us find it difficult to memorize the values and know which investigations we are required to do and what they mean. So if you have any difficulty with that, this video is meant for you. So let's start. Okay, so our main objectives of this discussion are the following. Number one, we've got hematology and iron studies, and we'll do LFTs, coagulation studies, lipid profile, arterial blood gases, glucose tests, renal function tests, cardiac biomarkers, thyroid function tests, and cerebrospinal fluid analysis. So these are the most profound tests that we have to know. We need to know the normal for us to identify the abnormal. In layman's terms, there's no way we can identify the abnormal minus knowing the normal. So these particular tests we are specifically talking about the normal values, but I'll be explaining further about the other values, the abnormal and which ones can be the normal ones. That's what I'm trying to elucidate in this video. Okay, so now our first piece of work is laboratory values and investigations in hematology. Okay, so this is a very profound one. Okay, it's very profound in the way that if you're in medical school, you'll be asked a lot of things about the hemogram. So they'll ask you about the anemia, they'll ask you about thrombocytopenia, they'll ask you about polycythemia, just to mention a few. Okay, so this is a very important slide. It talks about the most relevant things under hematology. Okay, so the first one is hemoglobin or hemoglobin. So under hemoglobin, the value differs. Okay, the values differ according to what? According to sex and the age. But in this video, I'm specifically talking about the adults. I'm not focusing about the pediatrics. So I'm focusing about adults, and this is why the values that we are going to discuss in this video are usually specifically talking about adults, unless indicated otherwise. So the HB, also called hemoglobin, in the male, it's 13.5 to 17 grams per deciliter. So that's the normal value of hemoglobin in the male. So now hemoglobin, it tells you a lot about the the HB, okay, the hemoglobin in the blood, and that's a normal value. Now, if you find that your hemoglobin is less than 13, usually it's less than 12 or less than 11, you're going to have what is called anemia. Okay, you're going to have anemia. So it tells you about anemia, right? Or polycythemia rather. So now the most specific things about anemia. So you just need to understand the normal. It should be between 13 to 17 in the male, and then 11 to 15. Others will say 11 to 16 in the female. Okay, and that's very important to remember. And then the second thing is what is called the mean corpuscular hemoglobin. Okay, the mean corpuscular hemoglobin is also something that is very. So now the question that you'll be asked is that what does the mean corpuscular hemoglobin indicate? So it indicates the average mass of hemoglobin in each red blood cell that you've been given. Okay, that's what it indicates, the MCH. Now this is also important in terms of classifying anemia according to morphology. We'll discuss that. That is the topic for another day. Okay, it's very important. So for this one, I usually use others will say 26 to 31. So if you're in Zambia, I usually refer it to election period, because like in 2026 people are voting, and then people vote after 5 years. Then they are general elections. So meaning that will be in 2031. So between 2026 and 2031. So I remember 26 to 31 picograms. Okay, and then we've got the mean corpuscular hemoglobin concentration. So for the mean corpuscular hemoglobin concentration, I also memorize it using elections from 2031 to 2036. That's how I memorize it. So now this one is in terms of percentages, or you can say grams per deciliter. That's the mean corpuscular hemoglobin concentration. And what does it indicate? So it indicates the concentration of all hemoglobin in all red blood cells. Okay, the entire concentration. So I think this one is better when it comes to classifying anemia based on the morphology. Because you classify anemia based on the morphology. There are a lot of classifications, by the way. But if you're classifying anemia based on the morphology, this is one of the parameters that is most useful. Okay, if it's less than 31, we'll say it's usually hypochromic. Okay, if it's between 32 and 36, it's normochromic, and we don't have hyperchromic whatsoever. Yeah. So the last one under the what is called red blood cell indices is mean corpuscular volume. So mean corpuscular volume is the most profound one in terms of classifying for you anemia according to morphology, as in whether the cells are small, which is called microcytic, or whether the cells are normal, which is called normocytic, or the cells are larger or bigger, or I don't know the term to use, but whether the cells are more than whether the cells are big, we call them macrocytic. So you can classify anemia as microcytic, normocytic, and macrocytic. Now, what do we mean by normocytic anemia? When the MCH is between the MCV is between 80 to 96, meaning that the mean corpuscular volume is normal. What does it indicate? What does it measure in other words? So it measures the average volume of a red blood cell. A single red blood cell, what's its volume? So the normal volume of a single red blood cell is between 80 to 96. So if it's more than 96, it means its volume is increased, and therefore that is a macrocyte. So that is macrocytic anemia. Others will say 100, so it's okay. 80 to 100 is okay. Other literatures will tell you 80 to 96, which is also okay. Now, if the MCV is less than 80, meaning the average of a single red blood cell is less than 80, and that tells you to say the cell is very small, and that is indicative of what is called microcytic anemia. Okay, microcytic anemia. So that being said, we've got three different types of anemias under morphological classification: microcytic, normocytic, and macrocytic. We'll talk about the things that can give you a microcytic, megaloblastic, and whatnot some other time. This lecture is specifically talking about the normal values. Okay, the other one is what is called the packed red blood cell. Okay, packed cell volume or hematocrit. So hematocrit is just the ratio of a single red blood cell to the total blood volume. All right, so a single blood cell, or you can just say ratio of red blood cell to total blood volume. That is what is called the hematocrit. Okay, so now this one differs according to sex and the age as well. So now we're talking about adults. So it's 40 to 54%. So that I've expressed is in ratios. So you can convert that into percentage by multiplying by 100. So it's 40 to 54 in the male and 37 to 47 in the female. Okay, that's the difference between the two. Now this can be increased. If it's more than 54 in the male, then it is increased hematocrit or raised hematocrit. It can be seen if someone is dehydrated. Okay, someone has vomited a lot, they have had diarrhea, they have got polycythemia, for example, they have a raised hematocrit. Okay, others will have a reduced hematocrit. Okay, and it can happen maybe due to rehydration after rehydrating the patient, or pregnancy. The hematocrit can reduce. Sometimes it can be raised depending on the condition. I'm just giving examples. Okay, and then after that we've got what is called white blood cells. So if you say white blood cell, this one is very, very broad, because these are also called leukocytes. Okay, leukocytes white, so white blood cells. The normal is 4 to 11 times 10 to the power 9. Others will just remember 4 to 11. If you have got less than 4, then it means that your white blood cells are reduced, and that is called leukopenia. Then if you have got more than 11, it means your white blood cells have increased, and that is called leukocytosis. Okay, so you need to know that. But remember, the white blood cells are further divided into two. We've got granulocyte and hard granulocytes. So granulocytes, these are the ones that have got a lot of what nuclei in them, like neutrophils, eosinophils, and basophils. Then you've got those what we call granulocytes, which do not have a lot of nuclei. So you've got monocytes, for example, okay, and the many others. So you can memorize these values if you want. They are not so important at this stage, but you need to know whenever there is eosinophilia. Okay, so eosinophilia it means there's an increased eosinophil count, and it is an indicative of parasitic infection. Okay, sometimes hypersensitivity reaction type 1. Then lymphocytosis, meaning there's increased lymphocytes that can be seen in infections. So you need to know that. You need to know that when there's raised neutrophil count is usually in acute inflammation. So you need to remember that as well. Now, the most other important thing is platelet count. Platelet count are very, very, it's very, very important to remember it. Okay, so the normal is 150 to 400. Forget about times 10 to the power. Just remember it's 152 to 400. That's your platelet count. It's important. If your platelets are also called thrombocytes. So if they are reduced, we call it thrombocytopenia. They are increased, meaning more than 400, it's called thrombocytosis. So you have got different conditions, variety of conditions that can increase the thrombocytes, and the ones that can reduce the thrombocytes. So we'll discuss all those in details when you start doing the conditions. Then Point number 8 is about the serum B12 levels. Remember, you can have what is called vitamin B12 deficiency. Okay, this is strongly seen in vegans. Okay, strict vegans, those people that do not consume meat. Those people that do not consume meat, they have got what is called they are prone to have a serum. They are prone to have a vitamin B12 deficiency anemia. So we'll talk about B12 deficiency anemia nicely, and the normal serum levels of vitamin B12 is 160 to 925 nanogram per liter. Okay, others will use it equal more per liter. So, but the one that is usually profound or used is the nanogram per liter. So it should be 160 to 925 nanograms per liter. That is for serum B12. And then serum folate levels. So folate, remember, is vitamin B9. So vitamin B9 deficiency is also called the folate deficiency or folic acid deficiency. The normal serum levels of folic acid is 4 to 18. Okay, so this is very, very important. The folic acid, okay, it can be caused by a lot of things, that alcohol, okay, and many others. And then you've got number 11, which is called reticulocyte count. Okay, reticulocytes, these are young red blood cells. Okay, they are small red blood cells that are immature. Now, you're not supposed to see a lot of them in the blood. Okay, these are not supposed to be seen in the serum. So if they are seen, there should be a problem somewhere. Okay, the normal is 0.05 to 0.15, or if you convert it into a percentage, is 0.5 to 1.5%. Just imagine about 1.5% of small red blood cells are in the blood. So if you find more than 1.25, for example, you find 5 or you find 10% of them are small red blood cells, it should indicate to you to say there's something that is ongoing in the body, and usually it's bleeding, hemorrhage. The patient is bleeding, they get to have a raised reticulocyte count, which is called reticulocytosis, or the patient is having hemolysis, like what happens in sickle cell disease because of their hyperhemolytic crisis that they tend to have. There is increased reticulocyte production by the bone marrow in the extramedullary sites. That's very, very important to remember, by the way. So in short, you're not supposed to have a raised reticulocyte count. Now, reticulocyte count is also used in determining what is called pancytopenia. Okay, so when they say pancytopenia, what they mean is that all the lineage cells are reduced. So platelets reduced, white blood cell count reduced, red blood cell count reduced. Okay, so the reticulocyte count becomes very important in such instance because you want to identify where the problem is coming from. Because remember, reticulocyte count is also somewhat giving you the bone marrow activity, like how are the bone marrow, uh, how is the bone marrow producing the red blood cells, okay, which are called reticulocytes. Then, because remember, reticulocytes, they have to undergo a certain phase of maturation for them before they become the normal or mature red blood cells. And remember, the red blood cells are smaller than the reticulocyte count because the red blood cells would have lost their nuclei. Okay, they lose their nucleus, and then they become smaller. Okay, and the other organelles. So you need to remember that. So if you have got a reduced reticulocyte count and all the cells are reduced, we call it a pancytopenia, and it tells you to say the bone marrow is failing; it's not producing red blood cells. So that's also important to remember about reticulocyte count. Very, very important. So if they are low or they're not there, we call it aplastic anemia. Everything is low. Yeah, that's what you need to remember about reticulocyte count. And then we've got what is called ESR, erythrocyte sedimentation rate. So now, ESR, guys, is very, very important. You need to know it, okay? And the reason why it's important is because it indicates the rate at which red blood cells are falling in the test tube. So you get that test tube and then you put blood there. Okay, the rate at which red blood cells are falling from the top going to the bottom of the test tube. That is called ESR. So usually it's less than 15 millimeters in an hour. Okay, less than 15 millimeters in an hour. So if it falls more than that, then it means there is raised ESR. So now, ESR is usually used in what is called, it is also referred to as one of the acute phase reactants. Okay, it indicates acute inflammation that is ongoing. Though it's not specific because it can mislead you. All right, and the reason why it can mislead you is because it is really dependent on the hematocrit, right? And then also the inflammatory proteins that are in the test tube. So remember, if they have got a lot of inflammatory proteins, the blood is going to be heavy, isn't it? So it will likely to sink at the bottom than to float. You get the point. That's why it will fall very fast from the top of the test tube all the way up to the bottom. Okay, that means that there's an inflammation that is ongoing. That is why you are going to have such kind of an incident occurring. Okay, so if it is raised, then it tells you to say there is an inflammation. But remember, there are instances whereby someone is anemic. So if someone is anemic, it means that this ESR is going to be slow, and therefore it will be more than 15. It will take more than maybe 3 hours for it to drop for about 15 millimeters. So it will be reduced. Reduced ESR. So the rate is going to reduce in such instance. Therefore, it will give you a false positive, even if someone has got an inflammation. So in short, it's not specific for inflammation, the ESR. That's why you prefer the CRP and procalcitonin to ESR for that reason. So ESR is not specific because it can be affected by anemia. In short, anemia can give you a false negative, meaning that the patient has got a condition, but it can't be indicated because there are few red blood cells in the blood. In layman's terms, that is for ESR. The last one, but not the least under the hematology, is what is called red cell distribution width. Red cell distribution width, RDW. So now, red cell distribution width, it measures the variation in the shape and sizes of red blood cells. Okay, remember the normal is that we're supposed to memorize always that the the normal is always supposed to be that the the red blood cells should have the normal shape, the same shape and size. Okay, that's a norm. Okay, so now this RDW or red cell distribution width, it tells about the variation in terms of the size and shapes of those red blood cells. I'm telling you, they ask a lot about them in an exam setting, so you need to know them. Okay, so it tells you about the variation, and that variation is just between 11 to 15. Okay, meaning that you need to have the differences in terms of the shape and sizes of red blood cells. Okay, you need to have them about 11 to 15, but if they are more than 15, that should be a problem too. It should be of concern because you're not supposed to have a lot of differences in terms of the shape and the sizes of red blood cells. So it's usually in sickle cell disease, very specific for sickle cell disease, there's raised red cell distribution width, which is more than 15%. So that's very, very important to remember. Okay, guys, thank you very much. That was Dr. William answer. Thanks so much for listening. Please give me the feedback about the video. Give me the feedback about the video. Don't forget to share this video with your friends. Don't forget to like this video and don't forget to subscribe to my channel. Thanks very much. Thank you. Twaluma, Zikomo, Twatasha, Litumezi, Asante sana, Mercy Boko, William Chansa, signing off. Goodbye.